Dental Bytes with Dr. Dunlop is sponsored by Better Life Center Implant and General Dentistry.
Well, this morning we continue our monthly chat with our friends over at Better Life Center Implant and General Dentistry to discuss all things dental. Now, the owner of the practice, Dr. Ryan Dunlop, joins me now to talk a little bit about sleep disorders and the appliances that he makes to treat issues like snoring and sleep apnea. Doctor, good morning. Thank you so much for being here this morning.
Oh, thank you for having me. It's my pleasure.
What is sleep apnea for people who may not know, and how many people are affected by this?
So this is an incredibly common condition in the United States. Sleep apnea affects millions of Americans, and it's really negatively impacting their lives every single day.
And if you don't mind kind of describing how much it impacts our life, is it on a day-to-day basis? Is it kind of a weekly thing? How does that work?
So sleep apnea is a condition of collapsing airway when you sleep. So when you lay on your back, you lay on your side, you fall asleep in a chair, you snore, you gasp for air, you have a collapsing of the anatomy in your throat, and that keeps you awake. And so you never really enter a deep sleep, you never get a comfortable, restful sleep, a healing sleep, and it really impacts your life negatively and cuts years to decades off your life.
It looks like it also costs people some hours of sleep throughout the night. I know a couple people at home who like to stay up throughout the night. I don't think they do from sleep apnea, but for those who do suffer from sleep apnea, what are some of the common treatments that they may do?
So the most common treatment for sleep apnea is what we call a CPAP, which is kind of like a scuba mask that you wear over your face, and it's very uncomfortable to wear. It's very hard to travel with. They're very cumbersome, and they really negatively impact your lifestyle. What I have been using in my practice for years are these devices that you can wear in your mouth that positions your lower jaw forward so that your airway doesn't collapse when you sleep, and they are a game changer for people.
Now, before we go into that, I do want to go back to the CPAP. We just showed it right now. What can people expect from it? It just seems like you said a big old scuba mask that they have to wear.
It is very cumbersome. A lot of patients who come to see me, they already have a CPAP and they're struggling with it. They don't use it, and they are miserable because of it. It does help with the sleep breathing, but it really negatively impacts their lifestyle. So they come to me kind of desperate for another solution.
And that solution that you have, how much does it defer, and how much does it kind of help differ from CPAP?
Well, as you can see here, it's a very easy to wear device that fits over your upper and lower teeth, and it positions your lower jaw forward so that your airway doesn't collapse when you lay back. So they're easy to wear, they're easy to keep clean, they're easy to remove, easy to travel with. If you ever were to break it or lose it, we can remake it very easily. So it's a game changer for people who suffer from sleep disorders.
Now, the big thing on people's mind, if they do want to try this, is going to be the insurance. So how does insurance often pay for that, like for sleep apnea treatment like the one you're offering?
Great question. Well, come in and see me. There are lots of options for using your medical insurance to do this. We have to have a proper diagnosis, so you have to see a sleep diagnosis clinic, and you get a diagnosis of mild, moderate, or severe sleep apnea. And then we can make the device sometimes under your medical insurance, and the out-of-pocket expenses are relatively low.
And if anyone at home is interested, how can they reach you?
So check out our website on betterlifedentistry.com. You can call the number on the screen here and schedule a consultation. It's a very easy consultation to come in and see me. I'll do a series of x-rays and exams and to make sure that you're a candidate for this, and then we will refer you to a sleep center to get a diagnosis, and then we can make the device in a couple of weeks. It's very easy.
Looking to help out sleep apnea one patient at a time, Dr.
Well, I am a patient. I have one of these. I use it, and it really does change your life. It gives you more energy. It gives you a better outlook. You sleep better. You heal better. So it is the way to go.
Great choices there, Dr. Dunlop. Thank you so much for being here this morning. Great to hear from you. Great day. We'll be right back.